Does the injection to help deliver the placenta help to reduce the chance of postpartum hemorrhage, which is more than 500 ml of blood loss straight after birth? Now, this is worth watching and safe for all women so that you can decide whether a physiological, natural delivery of your placenta is better or whether the injection for your placenta is better. So the first thing I would always say is it depends on your risk factors as a starting point. So go and check out my previous video on risk factors of effects of postpartum hemorrhage, and it's added to the Labour and Birth series too for you to have a look at. And as a recap, you have two choices. So you can either wait for your uterus to start contracting down, having crampy after pains, and then you'll feel some pressure or an urge to push in your bottom. That's called a natural delivery of your placenta. Your midwife doesn't touch the placenta at all. You push it out. It's soft, it's squishy. It's nothing like your baby's head was or the actual delivery itself. And actually by doing that, you avoid the side effects of the injection, for example. Now it can take longer. It can take up to an hour on average to deliver the placenta. And at the hour, if your placenta wasn't delivered, your midwife will re-offer you the injection for your placenta to try and help speed things up. Having a nice empty bladder, breastfeeding, skin to skin, golden hour after birth to keep it nice, dark, quiet to help promote that oxytocin naturally is really important. And delay cord clamping as well, because actually if you're emptying this cord, it will help the physiological process of the placenta delivering itself. Now the risks to this include actually potentially having an increased chance of blood loss straight after birth. So immediately after the placenta is delivered, there is a higher incidence of having an excessive amount of blood loss compared to the injection for your placenta. And the idea of the placenta injection is to try and reduce the chance of postpartum hemorrhage, and that's why it was designed and invented. Now the Cochrane database have got a really good overview as to what the evidence is for having the injection for your placenta or deciding to actually physiologically deliver your placenta. So the evidence is unclear whether the injection for the placenta decreases the chance of having a severe postpartum hemorrhage over a litre for women who are at mixed risk of having a postpartum hemorrhage. However, in these studies, what they found is that maternal anemia, so that's a haemoglobin level of less than 9, was much less in the women who had the injection for the placenta than the women who did not have the injection for the placenta. Now, when the authors looked at postpartum hemorrhage between 500 ml to 1,000 ml in women at mixed risk, so that's all the risk factors that I've suggested in that other video, actually they found that actually having the injection for the placenta does reduce the chance of having an increased blood loss between 500 to 1,000 ml too, highlighting that oxytocin and potentially the ergometrin does reduce the amount of blood loss straight after birth for the women who are at higher risk of a postpartum hemorrhage in general. It's also worth noting that the injection for placenta is one of the first line treatments for a postpartum hemorrhage. So if a woman is having a postpartum hemorrhage, it's one of the first medications and drugs we give to stop her blood loss becoming even more. Now, for women who are at low risk of postpartum hemorrhage, who have no risk factors at all, these women are comparable in both groups, whether they have a physiological or whether they have the injection for the placenta in terms of how much blood they lose. And the evidence suggests that what we need to be doing is adequately counselling women about the side effects of the injection for placenta for them to make their own choice, particularly when it comes to being in a low risk category. And the side effects of the injection for placenta include nausea and vomiting. These are really common side effects, and that's because of the oxytocin in it. Also, having after pains can be increased for some women as well, having the injection for the placenta. For women at high risk of high blood pressure, they are to have syntocinon or not sintimetrin after birth, and that's because the ergometrin, part of sintimetrin, one of the most common drugs that we give afterwards, can increase blood pressure, which is to be avoided in women with high blood pressure like preeclampsia, for example. But it's an injection into your leg or into your arm, for example, so that can cause discomfort for some women. And it may also increase the chance of early cord clamping for the babies as well. Now, there is no evidence that we should be cutting and clamping the cord early, even with the injection for placenta, but this is a change in practice that has come in over the years to show that there's no adverse effects for having the injection for the placenta and cutting the cord at a later stage. But it is a change in practice that's happened over time. Hopefully that's answered your questions on the placental delivery.